A warm welcome to everyone joining us for this panel, in which we will explore the experiences of Africa-based fact-checkers around the pandemic. There certainly has been brisk growth in fact-checking on the continent, with 19 operations so far, according to the latest census by the Duke Reporters Lab. Interestingly, nearly half of those have come in the last year or so. But when you consider the continent's population of more than 1 billion and that there are nearly 300 fact-checking organizations globally, that seems like an underrepresentation. We will, with my panelists, whom I will be introducing shortly, explore the structural issues around this. In many ways, the environment fact-checking in Africa finds itself is much like in other societies. More connectivity means more competition for clicks and digital eyeballs. Much the same, from for-profit to propaganda, and finding rich ground in the crisis of the day. The platforms used to seed false information are familiar. Like in other regions, we in Africa focus on issues of social benefit and that people care about, such as health. We ask ourselves pretty much the same questions about impact, about scaling up our work, and about breaking out of urban ivory towers. But in many other ways, there are differences. Worldviews in Africa, for example, are more communal rather than ideological, and are very experiential. We emphasize relationships. We inherently believe the intentions of others are idealistic. We tend to have very young populations. Culture plays a major role. Our societies are still very much based on hierarchy. I could go on and on, but in a nutshell, in the search for solutions, we would do well to remember that no one approach fits all. To shed more light on this, and without further ado, I will now ask my panelists to introduce themselves and to give us a brief overview of their organizations, as they will do a much better job of that than I could ever hope to. I will start with Dubawa in Nigeria.
And to everyone watching, good morning, good afternoon, and good evening. My name is Ebele and I work for Dubawa, a fact-checking organization in Nigeria.
Pesa Check is a fact-checking organization based in Nairobi, and we started out in 2016 with the aim of looking at misinformation around how, and reporting around how budget and public finance issues are reported on and looked into in Kenya, and we grew slowly into Uganda and Tanzania.
Hi Lee, hi everyone, my name is Sammy Mupfuni. I'm the directing manager of Congo Check, which is the first fact-checking organization in the Democratic Republic of Congo. We have been working now for 2 years with a team of 20 people.
GhanaFact, it's the newest fact-checking project on the block. Amongst the members of the panel, we are the newest. We just launched last year in August and published our first reports in September. And between that, we've managed to become now signatories to the International Fact-Checking Network Code of Principles. So GhanaFact is Ghana's first full-time fact-checking organization that is now signatories to the International Fact-Checking Network. Since we launched, we've managed to be involved in 1 or 2 collaborations. We are now part of the IFCN Covid-19 Alliance, which is helping tackle disinformation around the coronavirus. I should also mention that we are part of the Info Finder project by Africa Check, which is the pioneering fact-checking organization on the continent. Basically, it has brought together some fact-checking organizations on the continent, including GhanaFact, ZimFact, and also Dubawa, to create a repository of facts for people who serve the net on the continent. So these are the 2 projects we've been involved in outward. But here in Ghana, we are trying as much as possible to build a community of fact checkers in Ghana through trainings. So we have tried to do some trainings for about 200 students, journalists, and also news editors. The most recent trainings we did for news editors was, I think, last month, where we got about 6 news editors across the country and did some trainings for them as we try to expand fact-checking and expose people to some digital tools that could enhance their work in terms of doing fact-checking and verifying information. So GhanaFact is on, and we are trying as much as possible to kind of collaborate with mainstream media organizations, because in Ghana we have radio and television being the leading outlets where people consume their news. So the most recent collaboration we've had with some mainstream media organizations is a partnership we've had with Ghana Web, which is the leading digital platform in Ghana, where we are hoping that anytime we produce fact check reports, that would be republished on their platforms. We are hoping to expand these collaborations. So anytime we produce some of our fact check reports as a third generation fact checking organization, we don't just aim to publish reports. We hope to hold people accountable and ensure that the right information is pushed out there. So through these collaborations, we are hoping that we can achieve objective of not just fact checking, but holding people accountable.
So I will ask you, just how prepared were you to tackle false information around the pandemic, and what changes or measures have you had to institute in your organizations?
In terms of the different forms of disinformation and misinformation we have seen within the period, they've come in amazingly a number of forms. We've seen text, we've seen audio that's going viral on WhatsApp and even on other social media platforms, including Facebook and Twitter. We've seen kind of unproven cures also going viral. And I should mention that it's quite impressive this time round that previously, where we were finding challenges in terms of getting information from state agencies and government, this time round, because this information keeps on coming in thick and fast, we've had like the Ghana Health Service in Ghana give up to minutes response to some of the disinformation we have encountered. You pick the phone, you call an expert there, and the person is willing to give you some information to either counter or confirm some disinformation that you've encountered. We have the Food and Drugs Authority here in Ghana, always willing to give information to either confirm or debunk some of the different forms of misinformation that we've encountered here in Ghana. So I generally think there is a problem that needs to be dealt with in terms of the coronavirus pandemic and people taking advantage of it, weaponizing disinformation. And the response that has come in has helped, but there is more to be done, because currently there is the easing of restrictions, and we've seen some people kind of change their ways in terms of promoting disinformation and misinformation. Where previously we were seeing audio, text, videos pushing misinformation, now we are seeing people do some form of promotions to push misinformation, job alerts to push misinformation. So this time around, we will need to get to private companies, some parastatals, some multinational organizations, even the World Health Organization, UNICEF, UNDP. We need to get to them sometimes to confirm if they have put out job ads, kind of encouraging people to apply for jobs. Some hoaxes that have also been promoted since we saw the easing of restrictions, kind of because of the difficulty people have gone through throughout the lockdown. People are saying there are coupons and discounts being given out. So you click on a link and it doesn't take you anywhere. You don't really know what you are doing by clicking on that link, but people do as susceptible to it, so people do click on these links. So change the way they are going about dealing with these and see the changes in.
Okay, thank you very much, Rabi, for that. If it's a he, that is, I'm not sure. What has been the toughest challenge you had to face in fact-checking coronavirus-related fake publications in each of your countries? So this probably speaks to the medium, but and I know Ebele has touched a bit on it, but maybe quickly, Rabi, you can give us your experience.
This is a difficult one, because there there are some misinformation that you would encounter that sometimes you cannot debunk in the shortest possible time. Because these information, they go viral, and sometimes you would want to quickly put out the information to be able to curtail the effect that it would have on victims or vulnerable people who would want to act on them. You might want to quickly contact the necessary resource people to give you information. But there was one particular claim that till date, it looks like there's a challenge in terms of providing the necessary ratings for it, where someone claimed that for those who had recovered from the coronavirus, it could be possible that they might still suffer lung infections and might even be infertile after they have recovered. Now, we tried reaching out to the World Health Organization, we tried reaching out to the Ghana Food and Drugs Authority, and because the virus is so young and there has not been lots of research work done to actually ascertain the impact and how it would live on after people recover from them, it is not conclusive what would happen to those who have recovered from the virus. So it's taken forever. We've put out a report more like an explainer, but it was a difficult one in terms of providing ratings. So mostly we would say it's no evidence. We'll put no evidence attached to such a claim. So these are some of the difficulties and the realities. It's not like it's a black and white situation. It's binary, where it is either true or false. There are some gray lines in between there that fact checkers would have to think through and see how they can rate them and put out the right information to the public.
Thanks. Rabiu, have religious leaders been a challenge in Ghana?
Religion is a very interesting topic to talk about when it comes to debunking disinformation around COVID-19. It's faith-based. It's largely based on someone's belief. So if it is not narrowed down to a specific claim, we find it's a big challenge to delve into that particular sector and do the debunking of disinformation. There was one that came up earlier when Ghana first recorded cases of coronavirus, where we had the chief imam here in Ghana kind of give out some counsel to Muslims in the country and advice on how to use alcohol-based hand sanitizers. There were concerns that because Muslims don't consume alcohol, then why should they even use the alcohol-based hand sanitizers to protect themselves from the coronavirus? And the chief imam came out to give some counsel and some advice to Muslims, saying that if a Muslim finds himself in a very dire situation where alcohol is the only means of survival, maybe the person can even go for that. But it was circumstantial, if I could put it that way. But it was picked on by some media outlets, and they ran with it for clicks, saying that the chief imam had counseled people to drink alcohol, counseled Muslims to even drink alcohol. So this time round, because there was a specific claim, you can deal with it. You can cross-check with the office of the chief imam and see if you could debunk this disinformation. There have been also others about Pastor Chris. His video went viral here in Ghana. I'm sure it was same also in Nigeria and even around the world, where he made some pronouncements about 5G. So with this, it is specific. He mentioned something specific about a claim, and that could be debunked or confirmed. So this time around, fact checkers can go in there and do their work in terms of confirming or debunking it. But there are others, which is more, should I say, spiritual, where someone would say he's prophesying this, he's prophesying that, he had dreamt about something which could possibly be a cure for the coronavirus. We've heard of people saying they've been inspired or they've been guided by the Holy Spirit to say that if you put together a particular concoction and you drink it, it could possibly help cure the coronavirus. This one was specific because he mentioned some products that you would boil and use in preparing the concoction. So we put out the report here and we helped debunk it. There were others even also in Muslim-dominated areas where the person was speaking in a local language and was advising people to basically chew onion as much as you can chew, and it could help cure the coronavirus. And this time around, it's a specific claim, and if you can cross-check with the various authorities quickly, you can put out a report, and through collaboration, you can let it reach to the masses who have already encountered this voice note or the doctor image, and you can help put out the right information.